This is Jen and Nikina on eyesurgeontalks, and I wanted to do a short video about choroidal nevi. Now, what is a choroidal nevus? It's a mole in the eye. The same way as you can have moles on the skin, you can have moles in the back of the eye, because the back of the eye has some pigment in it. It's colored, and anywhere you've got those cells that produce pigment can develop into a little concentration of pigment called a mole. Now, why do we worry about choroidal nevi? Well, we don't worry about them so much, but we do like to make note of them as ophthalmologists, for the same reason that we like to look at the ones on the skin as doctors, because they can develop into cancers. Now, this change into a type of cancer, into a melanoma, is very rare. Just to outline that lots of people have little moles in the back of the eye, lots of people have moles on the skin, but not many of them at all develop into a problem. And actually, if they do, it tends to be a slow development. It tends to be very gradual. And in fact, sometimes when we see a suspicious mole that we think may be changing, often, we'll just monitor it. It's not something that we need to sort of investigate straight away immediately. If there's a little bit of suspicion, we'll often keep an eye for a few months to notice any changes. But if we have a lot of suspicion about a mole, if it's very big, or if it's got some other features which are concerning, we've got a list of them that we look out for, then we will certainly refer a patient to a specialist center, a specialist imaging and investigation, to look into it some more. Problem is, of course, you can't see them yourself because they're in the back of the eye. So often it'll be your optician who picks them up, but the optician will send you across to an eye doctor for a full assessment. And chances are we'll notice it, we'll describe it, perhaps we'll take another picture of it in a few months, and then again in a few months. And if there's no changes, then we'll say, we're not worried, everything is fine, and your optician can keep a little eye on it forevermore, and hopefully you'll never get a problem. But if there are ever any features of concern, we're very happy to have a look quickly and reassure you that everything is well.